Your pants are looser, your energy is lower, and that cough is still there, but you tell yourself it is just age. That is exactly how serious problems get missed. Cancer becomes much more common after age 55. The median age at diagnosis is 67, and overall cancer incidence rises to more than 1,000 cases per 100,000 people in age groups 60 and older. The danger is not that every small symptom means cancer. It does not. The danger is assuming every new, unexplained, or persistent change is normal aging. Cancer does not always announce itself with dramatic pain. Sometimes it shows up as a smaller appetite, a little more fatigue, a change in the bathroom, or a skin spot you stop noticing because you have seen it for years. And for adults in their 50s, 60s, and 70s, those are easy to excuse. You may already be caring for a spouse, helping grown children, or trying to stay strong enough to enjoy your grandkids. The last thing you want is another reason to worry. But catching a warning sign early can protect exactly what matters most: your independence, your mobility, your mental clarity, and your time with the people you love. The first red flag is unexplained weight loss. Not the weight loss you worked for, the kind where your face looks thinner, your ring feels loose, or you are down 10 pounds or more for no clear reason. Cancer can change metabolism, drive inflammation, reduce appetite, interfere with digestion, or simply steal energy from the body. Older adults often eat less with age, so this gets brushed off. It should not, if it is new and unplanned. The second is persistent fatigue. Not a busy day kind of tired. Not poor sleep after one rough night. This is exhaustion that does not lift with rest, weakness that makes stairs harder, errands feel heavier, or naps feel mandatory. Tumors can trigger inflammation, cause anemia through chronic bleeding, disrupt nutrition, and place a constant metabolic strain on the body. If fatigue is new, worsening, or comes with weight loss, bleeding, night sweats, or shortness of breath, pay attention. Third is a change in bowel habits that does not go away. New constipation, new diarrhea, narrower stools, urgency, feeling like you did not fully empty, mucus, black stool, or blood. A tumor in the colon or rectum can narrow the passage, change stool shape, irritate the lining, and bleed. People often blame fiber, dehydration, hemorrhoids, or just getting older, but a lasting change deserves a real look. Fourth is an unusual lump or thickened area. Cancer cells can form a mass where they started or spread to lymph nodes and make them enlarge. A new lump in the breast, neck, armpit, groin, or anywhere else that feels firm, fixed, painless, or keeps growing should not be written off as a harmless cyst or old scar tissue. Fifth is a cough or hoarseness that hangs on. A tumor can irritate the airways, block airflow, create inflammation, or affect nerves that control the vocal cords. Many people blame reflux, allergies, a smoking past, or recurring bronchitis. But if a cough or voice change does not go away, especially with breathlessness, chest pain, weight loss, or blood, it needs medical attention. Sixth is recurrent drenching night sweats or unexplained fever. Some cancers, especially blood cancers, can trigger powerful immune and inflammatory responses. If you are waking up soaked, changing clothes or sheets, and it keeps happening, do not just blame a warm room or old hormone shifts, especially if it comes with swollen nodes, fatigue, or weight loss. Seventh is blood in unexpected places. Blood in the stool, blood in the urine that looks pink, red, or brown, coughing up blood, vaginal bleeding after menopause, unusual bruising or bleeding. Tumors can ulcerate, irritate tissue, erode blood vessels, or bleed from fragile abnormal growths. Yes, hemorrhoids, urinary infections, and blood thinners can all cause bleeding too. But unexplained blood should never be brushed aside. Eighth is a sore that does not heal. That includes a mouth sore, a skin patch, an ulcer, a crusted spot, or a place under dentures that just never settles down. Cancer can keep tissue from repairing the way it should, so the area breaks down again and again instead of healing. If a sore lasts for weeks, bleeds, hardens, or enlarges, get it checked. Ninth is a change in an existing mole or a new suspicious spot. Melanoma tends to grow irregularly, with uneven shape, border, and color, and it evolves over time. Use the ABCD rule: asymmetry, border irregularity, color variation. Diameter usually over 6 millimeters, though it can be smaller, evolving change. And here is one detail many adults do not know. If you develop a new mole after age 30, a dermatologist should examine it. Now here is the part that gives you some control back. Food cannot diagnose cancer, and it cannot safely replace getting checked for warning signs like bleeding, a new lump, unexplained weight loss, or a changing mole. But food can lower long-term risk, support healthier weight, improve bowel health, and reduce some of the day-to-day conditions that make it harder to notice when something is off. In other words, while you are taking symptoms seriously, you can also build a body that is harder to fool. The strongest overall pattern is simple and not fancy. Eat in a more plant-forward way. More vegetables, fruit, whole grains, beans, lentils, peas, and leaner protein sources. Less processed meat, less excess red meat, and as little alcohol as possible. The American Cancer Society advises that it is best not to drink alcohol, and if you do drink, limit it, because all types of alcoholic drinks raise cancer risk. Start with vegetables. A practical target from the American Cancer Society is at least 2.5 to 3 cups of vegetables and 1.5 to 2 cups of fruit a day. Non-starchy vegetables like broccoli, Brussels sprouts, kale, spinach, cauliflower, and cabbage bring fiber and plant compounds that help the body handle oxidative stress and process potentially damaging substances. You do not need a perfect salad life. Add spinach to eggs, roast cauliflower with dinner, or put cabbage into soup. Then bring in beans, lentils, and peas regularly. Black beans, lentils, and chickpeas are especially useful swaps for red or processed meat. Their fiber helps move waste through the colon, supports better insulin response, and feeds gut bacteria that produce short-chain fatty acids like butyrate. That matters because butyrate may help the colon lining stay healthier and less inflamed. A pot of lentil soup, chickpeas in a salad, or black beans in place of some ground beef is a smart trade your body understands. Make whole grains your default at most meals. Oatmeal or steel-cut oats in the morning, barley in soup, brown rice with dinner, whole rye or 100% whole wheat bread instead of refined white bread. Higher intakes of dietary fiber and whole grains have been associated with lower colorectal cancer risk. In plain language, fiber helps bulk stool, improves transit, and may reduce how long the colon is exposed to potential carcinogens. Use whole fruit to replace some of the snack foods that quietly work against you. Apples, oranges, pears, and wild blueberries bring fiber and polyphenols, and they are less energy-dense than sweets and ultra-processed snacks. That helps support healthier weight over time, and excess body weight is a known cancer risk factor. A few habits matter just as much as what is on the plate. Stay physically active, because physical inactivity raises cancer risk. Protect your skin from too much ultraviolet exposure. And most of all, do not normalize new symptoms. A better diet is powerful, but it is not a permission slip to ignore a red flag. So here is your simple plan for this week. If you have a symptom on this list that is new, unexplained, persistent, or getting worse, make the appointment. Then look at your next 7 days of meals and make 3 upgrades. Swap one processed or red meat meal for beans, lentils, or chickpeas. Make whole grains your default. And get your vegetables and fruit closer to that daily target of 2.5 to 3 cups of vegetables and 1.5 to 2 cups of fruit. You do not need panic. You do not need perfection. You need attention, a willingness to act early, and habits that support your body instead of working against it. That is how you protect your strength, your freedom, and your time with the people who need you here.